As children return to schools, we're seeing a dramatic increase across the country of pediatric cases of COVID-19. But health experts say not every case is COVID. There is another virus that's making children sick. And ABC-7 medical contributor Dr. Neha Sharma, the medical director of the hospitals of Providence Northeast and Horizon City, joins me now to talk about it. Dr. Sharma, if all the cases aren't COVID, then what is it?
Well, Mark, the Delta variant has certainly created a new and pressing risk to children across the country, and it's overwhelming Children's Hospital. The number of children hospitalized with COVID-19 in the U.S. hit a record high this past Saturday with more than 1,900 kids in the hospital. This is not like last year. More than 90% of pediatric ICU beds in Texas are full as of this past weekend. But like you said, it's not all COVID. There is an additional culprit that's contributing to this surge, and the virus is called RSV.
Tell us exactly what RSV is.
It's known as a respiratory syncytial virus. It's a common respiratory virus that's extremely contagious and usually causes cold-like symptoms, but it can be really serious in infants and young children and can lead to respiratory distress, pneumonia, and bronchiolitis. Some concerning symptoms that parents should watch out for is difficulty breathing. If they see that, they should seek medical care right away. And symptoms are actually very similar to COVID. So parents and physicians need to look out for both. And the only way to differentiate is to get tested.
Now, does RSV usually surge in the summertime?
No, this outbreak is unseasonably early. It usually surges or occurs in late fall, winter, and early spring. Last year, though, we didn't see much RSV, and that was mostly because of the mitigating efforts like masks and hand washing and social distancing. And with the relaxation of these restrictions, mainly because of the vaccine rollout, I think that's what's possibly fueling the RSV rise. In Texas, the spike began late June, and actually all of my family, like myself and my kids, got RSV this past month, and thankfully we were able to recover at home.
We're glad you're okay, Dr. Sharma. So what preventative measures can parents use against RSV?
Wash those hands thoroughly, wipe surfaces down, cover your face while you cough and sneeze. And with the spike in RSV and the Delta variant surge in children, I'm also going to highly recommend indoor masking for children and adults, regardless of vaccination status.
ABC-7 medical contributor Dr. Neha Sharma, as always, thanks for coming on.
Thank you.